Happy holidays, everyone! I'm back at CSA. Last time, Dr. Contessa treated my pimple mark using Hollywood Spectra. And also, dahil nagsunken yung pimple mark, nilagyan din ng fillers ni Doc. As you can see now, it's not visible anymore. And today, Dr. Contessa will be treating my saggy jowls, especially on this side, yung left side ko, where it's visibly more saggy, as you can see. Before continuing to watch the video, don't forget to like, subscribe, and hit the notification bell to stay updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's welcome Miss Kim Liana. There you go. So we did a laser procedure in the past to correct that problem of acne lesion on the forehead region, and right now it's really improved. Okay. Then I was assessing her a while ago that next time we'll be doing a so-called forehead improvement, okay, because I was noticing also on her forehead right now there's a beginning development of the so-called dynamic lines plus volume loss on the inferior aspect of the forehead. So that's our future project, Kim. Okay, right now what we're going to work on Kim Liana, and her concern also is the lower part of the face, the so-called asymmetry. Okay, so we noticed on that side, left side, there's more of a bulge and there's more of a development of jowls. Okay, she's already noticing like a sagginess more on the left side. She's just 24, actually. Okay, but actually in the past we've already assessed Kim Liana's face. There was really an inherent asymmetry, the left and right. Okay, we already noticed like one side is narrower and the other side is kind of wider, right? And your best angle, yun, yung right side niya. So she loved the right side. It's more contoured and it has a more lifted and defined jawline. Now the other side, yung left side natin, there's like a poor jawline definition. Plus we notice a jowling there and also a beginning marionette fold or marionette line. And so this is something inherent. So we're saying that aging starts at, although we were saying before like 35, then it became 30, and now we're saying it's 25, so she's 24 already, okay? So it's also something that we want to improve. It's something inherent and something we can do with our non-surgical method, okay? So if we will be analyzing this aspect here, you'll notice like the jowl fats are like descending, okay? Sila yung nagsasag. So it could be yun, inherent siya, possible na genetics, or also yun, unhealthy lifestyle, baka laging puyat or overworked, over-fatigue. So even the face tissues also kind of succumb to the aging process, okay? So the descent of the tissues, the deterioration of the tissues, and the also volume loss, or what we call depletion of also some soft tissues. I was thinking of another factor, bakit ganyan? Actually, I think you lost weight. Right? Because I was looking at her, it's kind of she lost weight. And actually, when we lose some of our fat tissues, so kung nag-weight management ka, nag-weight loss ka, some of the fat tissues in the face, actually, they're also being reduced. So what's happening is some of our skin tissues, diba, they sag down. So those who are doing like so much of a diet or like so much of exercise, and then when they tend to lose weight and some of the fat tissues are going away, so the exterior part, so the skin layer, it's kind of like become loose or nag-increase yung laxity. So that could also be a factor for Kim Liana. Although she was saying it's just the same weight, right? Yes. Yeah. Pero I was like noticing your face, parang nag-narrow and slim din yung face na yan. So, what kind of treatment, what procedure will show you when CSA Medical Aesthetics returns. And we're back. So, we're mainly working on the left side of Kim Liana here. So, the left lower third. Okay, so we wanted to improve this saggy jowl here. So that's the main concern, I think. So I'll start with the device, the so-called Ultherapy. So I need some Ulthera shots into the soft tissue to give it also that tightening. And somehow we want to reach the subcutaneous fat layer to reduce a bit the jowl fats here. Okay, so I have my Ulthera. Okay, this is the microfocus ultrasonic device with visualization. Okay, and it works in those 3 layers. Okay, we have the dermis, fibroblast layer, the subcutaneous layer, plus also the SMAS layer. But what we want to target will be the layer subcutaneous parts. Okay, so we want to kind of reduce a bit that part, and also work on the dermis fibroblast to stimulate collagen formation and give that lifted and tightened effects. Then after doing this Ulthera, we'll combine it with our PDO threads, the threads that will further do the lifting. I'll be using some lifting cog thread to pull the tissues upward like that. Because I noticed you're having a big, marionette, right? This kind of puppet line. You notice that too in some pictures, right? So she's having the so-called labiomandibular fold, beginning labiomandibular fold. Okay, so if you're noticing something like that, you have to really treat it right away. Otherwise, it could become, deeper or severe. Okay, so if it's beginning, it's still minimal or mild, do something about it. Otherwise, you might have like a dented line here in your marionette area or labiomandibular fold area. Okay, so I have here, it has a gel, so the transducer is 3.0. So I'll just work on the jowl fats here. Okay, so there are like superficial and deep ones. So we're working in the superficial one. Okay, and the upper part of the jowl and the lower part of the jowls. Okay, so we'll be giving some shots here. You're okay? She's okay. Actually, we applied numbing cream a while ago. We left it for a couple of minutes to kind of still numb the area. Okay, so far so good. Yeah, there's some like tiny pricks, right, and some warm sensation. Yeah, because this kind of device, it will still emit certain temperature, something that will also induce a so-called thermal coagulation on those fatty tissue layers. So we're delivering those areas there, and we're working on this part here. I'll be giving some few shots only, up to some 30 shots. That's already enough to work on this part here. You can actually do combination of 3.0 and 1.5 to target the dermis as well as the subcutaneous layer. So actually this device has this visualization. I can actually see the subcutaneous layer 3.0. So the fat layer is being targeted. Okay, so we just have 5 more shots. And then after this, we'll disinfect the area, we'll clean the area to prepare for our PDO lifting, thread lifting. Okay, you're still good, right? And there you go. So after our Ulthera, actually I'm seeing already some kind of tightening effect already, because with the Ulthera, it induced like a thermal coagulation in the subcutaneous layer. Like it gives that tissue contraction instantly. Okay, so we have to really disinfect the area, and I'll be using my gauge 90 needle for my entry point. So the entry point will be anterior to the tragus. Like you can do a measurement 2 cm to even 3 centimeters anterior to it, and then I go a little bit inferior to the tragus area. So this is my entry point. Okay, there you go, tiny prick there. And then we'll use a spiral cog thread into this entry point. So it's significant that you know your entry point as well as your end point, plus the tissue layer you're placing your material. So we're doing a deep subcutaneous layer or even the smash layer. Okay, so those are the target layer. Then your vector is like more of a lateral vector here. So we wanted to improve the so-called marionette fold there, the beginning marionette fold, and the jowls also. So I'm just gonna direct it towards that marionette, okay? So we're delivering it up to that layer there, and after that, we'll be pulling it out, okay? And then I'll use the same entry point. I'm using a so-called end fix right now, a fixation type of thread. So it's really gonna be firm, and it's really gonna grasp the saggy tissues, okay? So entry point here, okay, and then I'm gonna glide in this layer. So for this one, you can inject your lidocaine into the track of your cog thread to numb the area, okay? So some resistance there, which is normal, and advancing it towards the inferior jowl. So I'm using the end fix type of my cog thread here. Okay. Can advance up to the anterior portion of the labiomandibular fold, okay, and then we're gonna pull it out. So we did these two lifting threads here, and I'll still combine with my so-called PDO screw type of threads. Okay, still okay. There you go. Then I'll use this mono screw type of threads. Just insert them in the subcutaneous layer. So you also want to induce collagenesis. So these types of threads help in the tissue regeneration. We call them already regenerative threads. Okay. So you wanted to improve also collagenesis and strengthen your dermis layer again and develop those fibrous connective tissues. So we're just applying 10 pieces of this PDO screw threads, okay? So we're done. We're gonna pull it out. Okay, there you go. And pulling out. And we're done with this side. We'll show the result to Kim Liana when CSA Medical Aesthetics return. What we expect is that there will still be some like redness and some temporary swelling from the multiple injections of lidocaine, and as well as the multiple insertions of those PDO screw threads. And also we had those two kinds of lifting threads. One is a spiral cog and one is the end fix type of thread. So we still expect some pinpoint bleed because we did some needle prick, needle puncture, and then our goal again is to balance the left and right. So we wanted to lift and to pull the saggy jowl on the left side. Okay, Kim Liana, your like what do you call this, comment, or like how was it? What was the feeling, or how's the experience?
No pain.
Yeah, I was really amazed because I was doing the injections of the lidocaine as if like she's not feeling the needle and the lidocaine being injected into those soft tissues, because I know I've tried the lidocaine on myself and it kind of burns, it stings, okay, but I'm really impressed that she doesn't cringe at all with the injections, okay, so she has that high tolerance for pain. Yeah. So right now what we see is still some swelling there, okay, because we did multiple injections there, and we'll just monitor the improvement. We'll like follow you up like 1 week, 2 weeks, we'll check on her, what's gonna happen. Plus the threads will still work inside. They will stimulate collagen formation. They will target the fibroblasts and activate them to regenerate the soft tissue. So this is a non-surgical approach whereby the process is like a gradual improvement, okay? Little by little, you're noticing some tightening and lifting. At least we've done something already to prevent the process of aging, to delay the aging, to improve the problem already and prevent the marionette fold, okay? So her right side is okay. So we just targeted the left. So this is one way how we treat those asymmetrical problems, okay? Like a problem on one side of the face, if you want to balance it with the other side, okay? So as much as possible, we want the face symmetrical, we want the face proportioned, balanced, okay? Left and right. Beauty is balance. Beauty is within proportions. We have the ratios and proportions.
Actually, nafe-feel at saka
Yeah.
nakikita ko pa, naka-lift na talaga.
Actually, you'll sense there's already like a cooling sensation or like a lifting sensation, and you're feeling already some tightening there. Even during the Ultera, I was like observing the tissues. I kind of already noticed like some soft tissue contraction there because the Ultera delivers a certain temperature, like around 60 degrees Celsius, to induce that contraction of the soft tissue. So somehow you're feeling the tightening already. Plus the Ultera will still work up to 12 weeks. Same thing with our PDO threads. Actually, the process of collagenesis from the 4th week to the 8th week to the 12th week. So gradually, you're noticing more improvement with this kind of treatment. And little by little, you'll notice some like lifting already. So somehow we want it to balance to the right side, okay? So we're going to do monitoring for you. We'll still do a check on you again. Plus, we have another project for her, the forehead area. We want to also fight aging. Okay, we don't want the forehead to become like a concave forehead because I'm noticing already a beginning flattening. It's becoming straight already. So even I need that. Okay, so we want a convex, just a smooth forehead, you know, and without wrinkles. We don't want dynamic wrinkles or static wrinkles. We want to delay the aging process. Plus, you're still very young, okay? When's your birthday? Coming soon? Okay. There you go. Thank you so much, Kim Liana. We'll see more of you. Actually, every time I see her, she's kind of becoming more beautiful and beautiful. I'm just so...
Thanks to you,
like, what do you call that? When you see a celebrity, starstruck. Okay, thank you, Kim Liana. We'll see more of you, okay?
I just want to say po na since you started taking care of me po, Doc, I'm more confident po na to go outside without wearing makeup.
Right, yeah. She doesn't need a makeup, actually, okay? And when we did the laser, right, it really helped improve her skin texture, the skin quality. You know what? The skin quality is already the #1 like parameter for rating you as very attractive. Yung skin quality daw dati. Kaya kailangan wala daw pores, walang mga lines, or walang mga pigmentations. And we'll do more treatment on Kim Liana here because, you know, she's been with us for quite a while already. So thank you so much for trusting us. There you go. Thanks for trusting CSA. And we're glad that it's improving your like sense of like having that confidence, that high self-esteem, and it boosts really your the overall beauty of Kim Liana. Okay? Thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Kim Liana, do you have any like Instagram that they can follow you?
Yes po. My Facebook page and my Facebook po is Kim Liana and my Instagram po is Kim Liana. You can message me po if you have questions kung ano yung na-feel ko, kung...
Right.
Or,
sometimes they're concerned about baka painful.
Yes po.
Especially this one, the cog lifting and the thread lifting. They're
Actually,
concerned about it.
hindi talaga po.
Yeah. She has high tolerance to pain. Okay? And if you also want to watch the other videos where we highlighted treatments of Kim Liana, please do check our YouTube channel, Contessa Salvador. And thank you for all those who have subscribed. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.